You know, our skin acts as the first line of defense for our immune system by protecting everything inside. But what happens when our skin struggles to do its job?
Well, Dr. Rance Hafner is a wound care specialist from Bellin Health's Wound Healing Center. Good morning.
Good morning.
Okay, we're going to talk about what these are and how to treat them. But let's start out. What is a chronic wound and what are some of the serious side effects?
Well, we've all had problems with a wound, like you cut yourself or something like that. That typically heals in like a week or two. A chronic wound is something that lasts for about over 30 days. If you have something that lasts for that long, you probably need a different type of care than your regular doctor could give you or you do at home.
Mm-hmm. And just looking at the effects, I mean, it can be really serious.
Yes, there's a lot of things that can happen. The wound healing is very complex. It doesn't seem that complex when you heal routinely, but you can get, your blood needs to clot, you need to have a scab formation, you need to get good nutrition to the skin. And all that can get messed up, so that's what a chronic wound is. Something goes wrong.
Okay. So how big of a problem is this? Are they common?
There's probably over 6 million people in the United States that have chronic wounds, and to put that in perspective, we have about 1.5 million people that have cancer in the United States on an annual basis.
So let's talk about who can treat a chronic wound. Do we see our primary care physician or do we need to see a surgeon or a specialist?
All physicians have some basic training in wound care, but when it comes to the chronic wound, you probably need somebody with some more insight into how to heal wounds. Mm-hmm. General surgeon can be helpful, cardiovascular surgeons can be helpful. All the specialties have their own role within the wound care. We try to put it all together.
Mm-hmm. And you offer something called hyperbaric oxygen therapy. What is that and who is that recommended for?
Hyperbaric oxygen is where you put more oxygen into the patient's body and your blood carries that to your plasma to assist with healing. We have these unique chambers that people can go into, and you have to increase the pressure that they go in, and it just helps a lot of wounds heal.
Let's talk a little bit about some of the other treatments offered by the Bellin Wound Center.
We also have other things where we have these tissue substitutes that help things heal. We have wound care specialists. We have wraps, all these things that can be very, very helpful for healing.
What's debridement?
Debridement is where...
Debridement. Okay, thank you.
Debridement is where you take tissue that is typically covering these chronic wounds, and it's not helping them heal. The wound kind of gets into a phase where it stalls, and we get rid of this tissue that isn't helping healing.
Okay. Now, if we're looking for more information, how do we start that process?
Well, you can call Bellin Health, and we've got a number that I'm sure you guys could tell because I always forget it. But
that's okay. Let's put that up. There you see it. The Wound Healing Center number is 433-7550, or head to bellin.org. And is there a certain time? Is it like 30 days or when we should call a doctor about this?
Yes, definitely after 30 days if your wound hasn't healed. Something's wrong. Call your doctor. They can refer to us. It's a great system.
Okay. We appreciate the insight. Thank you, Doctor.
Yeah, thank you.
Here's a